So Dr. Prashanthi is a cardiovascular disease specialist practicing in North Shore in Louisiana. She has 19 plus years of experience in internal medicine and cardiology. She is one of those doctors who totally believes in lifestyle correction to attain optimum health, and she integrates primarily diet and lifestyle correction to help her patients recover from many health issues and reduce their medications. So I will now allow Dr. Prashanthi to herself introduce how she got into this kind of, drugless medication system. How was her journey to nature cure, and take it forward from here. So welcome, Dr. Prashanthi.
Yeah, thank you. Thank you, Asha, and thank you, Valcure, and welcome everyone. So yeah, thanks for the kind introduction. So we are here. We've been working with Valcure. I've been working with Valcure for a very long time. We have been conducting lots of such sessions for blood pressure, cholesterol, thyroid, everything by addressing diet and lifestyle. We are helping a lot of patients, participants, and like modify their lifestyle in order to get into a better system rather than, getting into labs and getting into too many medications and all of that. So as you guys are new to this platform, so it's a lot of wealth of information that's available there. You can feel free to explore all the testimonials, the recipe plans. There are plenty of essays that are written on nature cures and natural hygiene. That's the topic that we're going to be talking about today. So a little bit about myself. I am from India. I graduated in 2002, but I moved to the US in 2003, and then I did my residency in internal medicine and general cardiology fellowship in past decade, I guess. So yeah, I have two young children. Now they're no longer young, actually. One of them is a teen, and then the other one is in her is 10 years old. So it's just my little bit of my health issues, the hiccups I had. And my daughter, my older one, had like a major health crisis, I would say, when she was young. That's when I started questioning the whole thing. And then when she was having issues, then that's when I started trying to find more answers, and I came across Nature Cures and Valcure, and whatever we are doing today is part of what has happened to me 10 years ago. So so I just want to know a little bit about you all. So we are like a small group because this is a little late today, I guess, but thank you for coming. And I just want to, we just want to know what brings you to this program. What is the main motivation for you to come here? Is it your own health issues? You guys want to understand more about what we're going to be talking about, lifestyle coaching? What are the main things that made you come here? You guys can put it in the chat. It's more, we can make it as interactive as possible, because that's the way we're going to talk, and we're going to approach, and we're going to discuss your health. See, most of the times what happens is when we go to visit our GP, primary practitioner, or anybody, what happens is they just get to spend 10 minutes of time. And most of the time it's just blood pressure checks or something, or we just go over some blood work. And then we say, oh, your cholesterol is up, your blood pressure is up, let's do some medication intervention. Or they just say low salt diet or low fat diet, whatever of that comes at that point is whatever AHA wants us to talk. But here we are going to be approaching it in a little different way, where we are going to be explaining to you guys are going to be your own guides and mentors of your health, and trying to figure out what happened. So foundation of how we ended up with the so-called high blood pressure and cholesterol, and then where we are going to go from there after the diagnosis has been done. So that's where we are trying to do it without the aid of too many medications. Actually, a lot of our patients, participants, once they are on this lifestyle plan, majority of them, they come off of their drugs because there is no role for drugs when the lifestyle is right. So anything you guys want to say about yourself? Otherwise, it's just going to be like me talking, but I just want to know a little bit more about it, about what brings you here to these sessions. Anyone wants to say anything? Or otherwise, we're going to keep moving on. Is it your high blood pressure issues, cholesterol, or is it just for general knowledge? Hello, so Asha is saying had health issues in the past, but since I'm approaching 50, I want to take care of general health. Excellent. That's what the whole program is about. So it's going to be, we're going to be giving you a basic understanding about what health is actually is and what disease is all about. So that's where we are where we are headed to right now. Yeah, thank you for answering, Asha, but rest of you also, you can take your time. Please let us know what brings you here. Ravindra is saying it's both health as well as trying to understand. Perfect. Let's move on. So Jessica has issues with pre-diabetes, want to take care and obtain healthy habits. Perfect. This is the way to go. So yeah, when we catch these things very young and we don't take any medications, it's going to be a easier one to fix. So now let's talk a little bit about what exactly. So today what we are going to be talking about is the high blood pressure as well as cholesterol. And as well as we're going to be talking about the basic things, right? We all know that there are lots and lots of people who are having coronary artery disease, as 1 million, then 16.5 million Americans around the age of 20 and older are living with coronary heart disease. So where I live, I don't know what part of the United States you all are from, but I'm from Louisiana. And it's kind of like the heart attack capital of the world. I guess that's what we would say, because of the food habits as well as the lifestyle that everybody has. It's entirely like totally very southern. So yeah, the fried food, and I'm pretty sure you guys have paid a visit to Louisiana at some point. Mardi Gras is the one that pretty much brings everyone down to south. So yeah, the lifestyle is pretty erratic, and then we have like a very young people like 20, 30-year-old having heart attacks, bypass surgeries, and all kinds of health related, lifestyle related health issues at a very young age. So the way we are trained, I'm trained at in New Orleans in the hospital system, where it's pretty young people very young people, pretty sick people are seen, and they come in with different kinds of conditions. So almost like 700,000 people will have a stroke this year. So these are just basic statistics that we all know. And we all know that the numbers are increasing. Younger and younger population, folks are age ranges are being diagnosed with high blood pressure, diabetes, and then slowly, gradually, we are moving more and more towards coronary artery disease, strokes, and heart failure. So 23 million adults with type 2 diabetes, 15. So it's like a pandemic of diabetes, high blood pressure, high cholesterol, followed by heart disease and strokes, and lots of other conditions. But all these are lifestyle lifestyle diseases. That's what we have to call them as. These are not like, we are born with it or something like that, but actually as we live, we kind of slowly, gradually build up such kind of diseases. Next slide. Obesity is on the rise. So it's pretty much everyone. Anybody has come to New Orleans? Like, do you know, like, have you been to Mardi Gras or any of them? So what part of the US are you guys from? If you can, I mean, I don't want your addresses or anything, but just the states are fine. So all of us are made to believe that, oh my God, cholesterol is so harmful for the body. So what is your opinion about cholesterol? Is it harmful to the body, or is it fine? Is it okay? Cholesterol, what kind of issue do you have? So cholesterol, are you guys scared of cholesterol, or are you trying to figure out what exactly is cholesterol is? So pretty much we all understand that, oh my God, cholesterol means there is stroke or there is heart attack that's happening. So this white waxy stuff that is sitting in our coronaries, as well as in the carotids, in the blood vessels that take blood to the brain, or it's very harmful. It's going to create a lot of harm. So yeah, Ravindra is saying he's worried about cholesterol. So let's explore what cholesterol actually is, and then we can come back whether it's harmful to the body or why is the body having excess amount of cholesterol built up. Next one. So is there a pill which can cure high blood pressure or cholesterol, like totally cure it, and you take care of it, you take a couple of pills, and then this high blood pressure and cholesterol goes away, and that you don't have to again and again keep on taking any kind of pills? Is there any kind of a pill? that's going to do that? Like magically, after a couple of days, after a couple of weeks, you don't have to take. So no, it just manages. Exactly, Ranga. It's exactly what it does is it just manages it that way. It kind of like keeps it in such a way that the blood pressure doesn't go up, the cholesterol doesn't go up. But the thing is, we don't know. This is at the surface level, but underneath, deep down, what is happening with this blood pressure suppression or whatever we are trying to do, masking the blood pressure and cholesterol, we don't know what else is happening. So that's where the exploration begins. That's where we are going to start working on trying to figure out what is happening with high blood pressure, cholesterol. Why is a pill in the pocket or a pill every day is not the answer for all these issues of high blood pressure and cholesterol. So beliefs about high blood pressure and cholesterol are, what happens is we always are being told that, oh, my grandfather had it, so I always have high blood pressure, so I'm just going to start taking a pill. So, and also we always consider it as I'm aging, I'm going to have high blood pressure and cholesterol, which is a norm of the day. And also, we also think that there are times when you take a pill, but still the blood pressure becomes uncontrollable, cholesterol becomes uncontrollable, and we have to start popping a pill, or not only one pill, multiple different pills have to be popped. Untreatable, and it has lifelong. Only thing that we can do is just treat it with few medications and make the numbers look prettier. And our general practitioner or primary care doctor is going to be happy with the way we are dealing with our blood pressure. And also a lot of times we have heard that, don't even think about lifestyle. This is not going to work. How much are you going to control your lifestyle? Just take the pill. It's easy that way. How many of you have heard that? And also it can be managed, but it cannot be reversed totally. So these are some of the beliefs that we are, or I would say these are some of the myths that we live in. So we consider it as genetic and we accept it because just like how we inherit property from our parents, we are going to inherit some diseases from them, age related. It's also uncontrollable. We end up taking multiple different medications and it is untreatable and it is lifelong affair with medications and pills. And also it's tough to reverse. Don't even think about lifestyle. So these are some of the myths that are kind of like are around blood pressure and cholesterol beliefs. And a lot of people, they just think, okay, if we don't take these and medications are just going to be the way to answer this whole thing. So they keep up with their, continue with their previous lifestyle and they keep taking their medications and they think somehow these two are going to merge with each other. So let's understand these myths first and then why this is not the right way of dealing with blood pressure and cholesterol, or as a matter of fact, with any kind of health conditions, lifestyle conditions, this is not the right approach. So far, you guys are with me, right? So is this what you guys were looking for when you signed up for the program? Because we need to understand what exactly is happening and how we are going to approach this one. So pretty much what are the causes of hypertension and cholesterol? Lot of stress in life, all kinds of food that is not even like, that we don't even know how to pronounce the names sometimes on the ingredient boxes. Lot of late night working and stress and career building and very inadequate, very little intake of any kind of healthier foods. And then the smoking is here. We all know pretty much like a lot of smokers have realized it. Not now, there is no longer a question. Almost the science has been settled with regards to smoking and what happens with our blood vessels, with what happens, the risk of heart disease, risk of stroke, and all of them. People are realizing this one. And a lot of fast food takeouts and sedentary lifestyle. So these are major issues why younger and younger population are building up hypertension and cholesterol. So we can by just trying to avoid all these and going back and reversing these. But how do we reverse these conditions? How can we do this? Let's work on that. So now let's take a small break from how we're going to reverse. First of all, let's explore some numbers, okay? Cholesterol levels, most of us are in the ages of 20 and over. So they have these cholesterol numbers. These are from like different kinds of agencies that we have here. So pretty much they all speak the same language. They all want the ideal cholesterol to be around 200 LDL. Everybody is scared about LDL cholesterol. It's less than 100 and HDL is greater than 100. 160, and then this is kind of like where we want everybody's cholesterol to be. But then we label them as borderline, too high and low, based on what their numbers are coming. And then what we do is, depending upon if they have history of heart disease, if they have history of high blood pressure, diabetes, then we have different kinds of risk scores that we can use, online calculators, and we plug it in and we tell the patient, okay, you are at high risk. You need to be on this much of cholesterol medication. You are at very high risk, so you need to increase your cholesterol medications. So based on their risk and everything, what we call as risk stratification, based on how much risk they have. So your chance of issues with heart attacks and strokes and everything increases when we have diabetes on top of high cholesterol, hypertension on top of cholesterol. So, and if the patient is a smoker, it increases furthermore. So they just have these basic guidelines. So what majority of the doctors do is they look at the numbers, they plug in the risk factors, they get the calculators out, and then they tell you your risk, and then they say, according to our guidelines, your cholesterol, you are at high risk, so you need to take high intensity statin, or they're going to say you're going to take moderate intensity statin. And then they say, yeah, sometimes we can do with lifestyle too, just eat low fat diet. That's what majority of our practices revolve around, because it takes some time and effort by participants in order to realize where things have gone wrong, how to fix it, but that time, none of us have it. And it's easier to pass on a prescription with a pill or not, in order to just make the numbers look pretty from the surface level, but deep down, there are so many issues that are going to happen. And only thing is, people will realize only after a couple of years of taking them what has happened, what has gone wrong. So blood pressure too, it's the same thing. All of us know, right? Our blood pressure has to be less than 120/80. Now they want us to call anything that's greater than 120 to be elevated blood pressure. Now high blood pressure numbers are rolled down, anything between 130 to 139. Before, in the past, we used to call them borderline high blood pressure, but now they're lowering the numbers. They want the numbers to be as low as possible. And then the high blood pressure, once you hit 140 over 90, you are labeled as high blood pressure. You are labeled as having high blood pressure. So the numbers, like slowly, they're just bringing them down at some point to 1. So before, when I was doing all these things, this wasn't like this. Like when I was doing my 5 years ago, the numbers were a little higher, but gradually they're changing the numbers and drastically lowering them a whole lot. So these are good. The lower the blood pressure for us, it's very good. So children are born with very low blood pressure. And as we age, because of hardening of the blood vessels, blood pressure starts going up, creeping up gradually. But the lower, the better for all of us. It decreases our risk for stroke. It decreases the risk for heart attacks and multiple other issues. But how much low are we going to go? And how are we going to lower this? Are we going to lower this medicinally, using a lot of drug systems, so that, well, let's see what happens when we start lowering it with medications to the lowest possible numbers that anybody could tolerate. Next slide. Any idea, if we keep taking medications and keep lowering it, what happens to us? What will happen? I mean, it's a pretty number. We're going to like it, and everybody is going to like it. Let's take more medications. Is that the way to go? So now, quick overrun of the heart attack, and like what happens? A heart attack occurs when the blood flow to the heart is severely reduced. We all know that, right? So how does the blood flow to the heart is reduced? These are the teeny tiny blood vessels, right? Called the heart vessels. The blood vessels that take blood to the heart are very teeny tiny, very narrow from the get-go itself. On top of it, there is a lot of sluggish flow of blood that is happening. And then there is a lot of cholesterol that's in there, as well as the as well as a lot of toxin that is built up in the blood vessel. So fat deposits are formed. On top of the fat deposits, many other lot of cholesterol plaques are formed, and then that's when these plaques, when they break off and loosen off, then a lot of issues happen in the form of clot over there and stopping of blood flow to the heart. That's how heart attacks build up. So high blood pressure and cholesterol, both of them contribute to heart attacks. But that's what we are trying to avoid, and that's what we are trying to get away from by helping ourselves manage very well with high blood pressure and cholesterol. So let's see how we can manage them. So what is the risk of persistent high blood pressure? Can you guys answer this question? Let's see how much you know. So blood pressure keeps running high, okay? The numbers are like 160/80 for a long period of time. Then what happens? Why are we so worried about high blood pressure? I mean, it's just a high blood pressure, just a number. Why don't we let it run high? So persistent high blood vessels, what happens is the elasticity of the blood vessel is lost and the blood vessels become so crippled, they kind of like, they start having issues. So a stroke will happen, eye changes, heart attacks, heart at some point is going to say, it keeps pumping against the high blood pressure, and at some point it's going to say, you know what, it's too much for me to take. I'm not going to pump this much, so the heart function goes lower. So then the kidneys are the ones that are going to be immensely affected because of the high blood pressure. So kidney functions are going to, it's not going to happen overnight, right? It's gradually, it's going to creep up. Creatinine is going to keep increasing. Kidney functions are going to go from stage 1, stage 2 to stage 5. And then at some point, patient is going to put on a dialysis. And peripheral, everything, sexual dysfunction, peripheral arterial disease, vision loss, everything is because of this high blood pressure that has built up, because at some point or the other, the blood vessels cannot tolerate that high pressure system. So complications, end organ damage. So we don't want to get into this situation of end organ damage. That's what we are trying to prevent it from happening. And that's what we are going to focus on today's lecture. So in the cost of the surgeries and everything, when you compare it for a heart attack and when people have to undergo any kind of stenting, it's almost like $32,000 US dollars, and bypass surgery is 75K. But majority of them is paid by, if they have insurance. I mean, a lot of it is paid by the insurance. But the thing is, what is the point of getting into all this mess when we can just address it with basic lifestyle changes? That's the main important thing. It's not fun to live with a stent in the heart. It's not fun to have bypass surgery. Like what they do is they just cut open the chest at the sternal level, they open it, then they start manipulating the heart and trying to do it. It's not like you go ahead and get a procedure done. Each and every procedure is associated with lots of complications, which are not even pretty to have. For example, an angiogram can lead to some kind of a kidney injury or a lot of bleeding complications, or just the stent process itself is related to a lot of complications. Then the bypass surgery, you cannot even it takes 3 or 4 months for the patient to recover, and lifelong they have to live with this bypass grafts and the worry about, okay, what is going to happen with those grafts? Are they going to close off? What are we going to do? So there is a lot that can happen. It's not like a simple bypass surgery. It's not like a simple stent, but the thing is the disease keeps progressing until and unless we address what is happening inside us or what has built it up. So, and then the cholesterol, and then the medications. Do you guys know any of the side effects that you have for the medications? For example, I'm going to talk about cholesterol medications. There are different kinds of cholesterol medications. We all know about statins, right? Pravastatin, or then you call them as Lipitor, Zocor, Lipitor, and all kinds of different kind of medications that are there. These are all basically, they come under one group, which are called as a statin drugs. These statin drugs are, they are very strong. Do we really need such strong medications? That's the first question. And then they always create a lot of muscle issues. Then they create liver issues. And also, most of the times, as time progresses, it also affects our memory, as well as brain fog and dementia. All kinds of issues will start happening. So the thing is, people always forget when we don't have any immediate changes to these, immediate adverse effects, a lot of times we don't connect two and two together. But the thing is, the damage is so much, has already been done in such a way that it takes a lot of time, or maybe it takes a lifetime for us to heal from these side effects of these medications. And also they're super, super expensive. And well, if we can address it basically with diet and lifestyle, why do we need these medications? Because we should never get into these when we have to prevent any kind of lifestyle diseases. So let's see further what we can do. So now, blood pressure, like you all know, there are tons of different blood pressure medications in different classes. We have them as diuretics, we have them as beta blockers, ACE inhibitors, all kinds of names. So what happens is, it's not just an innocent pill that you will be popping and your blood pressure is going to come down. It will have issues on the kidney. It's going to create issues with depression, confusion, blood sugar fluctuations, the sleeplessness, tiredness, all kinds of things will happen just by taking few of these. People do suffer from these side effects from time to time. A lot of them come back to us, and sometimes people don't even take some of them. They just keep quitting them or skipping their medications because of the side effects that they encounter from these medications. So what is the point of having so many side effects, and what is the point of taking so many pills when our body is not even agreeing to it? Well, we can just change few lifestyle changes, and we can just create, we can have best of our health. So let's figure out how to do that. So there is a simple trial that they did, but in order to understand the outcome, composite the outcome of like people having heart attacks, strokes, and death from heart attacks and acute CHF. So what they did was they did intensively lower the blood pressure. So they used up to 3 medications, and then they lowered it as much as they can. And they said, oh, wow, look at it. Patients are having less heart attacks. Patients are having less strokes. This is the best thing ever. So we have to lower it. But then what happened was they also encountered lots of high rates of low blood pressure, lot of dizziness. People were passing out because of low blood pressure issues, electrolyte abnormalities, which is secondary to the drugs, and also kidney problems because kidneys weren't getting enough perfusion, so enough blood flow. So even though they had a pat on their back saying that we did so well with 3 medications by lowering the blood pressure so well, they had side effects. Each and everybody had side effects because of the significant amount of intake of these. So, well, how about we lower our blood pressure, keep it as low as possible, but again, without the side effects of the medications and without all this dizziness and low blood pressure issue, passing out, and electrolyte abnormalities or kidney problems. So that's what we are going to be exploring, how to reap the benefits of having low blood pressure, decently well-controlled low blood pressure without the need of significant amount of medications. So here is, I'm going to like digress a little bit, and then we're going to come back to the main topic. We're going to be explaining to you about what is the principle what is the health philosophy that we follow at Nature Well Cure. It is called Nature Cures. It can be also called as natural hygiene. It's one of the oldest natural health philosophies where it's more like an observational health science where we just look at nature and understand nature and try to understand the laws of natural living. So not a practice of studying diseases and its cure, but it is always about how to maintain health. So how to restore health by living in harmony with nature's seasons, resources, and body cycles. It's a drugless system. You will not find any kind of medications or anything here. It's always about how do we correct our lifestyle in order to live an optimum life with better health, or the best of our health and best of our abilities. That's what Nature Cures and natural hygiene is all about. So like if you really observe in nature, can you tell us any animal other than humans that have hospitals for themselves, that have pills for their health, or who are having diabetes, high blood pressure, high cholesterol issues, and heart attacks in the wild? Any other animals in the animal kingdom? Do they have all of those wild animals live according to laws of nature. They all intuitively follow nature cures and natural hygiene in their everyday living. So that's why they never ever needed any kind of these gimmicks or any kind of pills or any other systems of healthcare. So here, what is all diseases are one and only one, and they're all from toxins. Toxin is nothing but the waste material that keeps accumulating in the body. For example, when we forget to declutter our homes, clean up our homes, what happens? Trash cans pile up, all the sink is going to pile up with dishes, dirty dishes. So all kinds of things will happen. The same thing happens to us too. If we do not live according to laws of nature, and if we just, like live the life that I showed you, like not sleeping on time, eating whatever that is there, and not having enough amount of exercise, all kinds of these things will build up toxins in the body. Toxins are external, that come from our diet, from the air, from the water we drink, and internal toxins too. For example, any kind of digestive process, if there is a lot of protein, then there is a lot of like amino acid breakdown and creatinine. So kidneys have to start working. And if we are not breathing well, if we are not eating right, all kinds of toxins will build up in us. So body always needs time and space in order to clean up those toxins. All it needs is time and space. There is no pill, there is no magic remedy, or there is no herb or anything that will accelerate this process. It's all in our hands. We give body time and space, and then the body is going to be cleaning up. So body is self-healing. All we need to do is to give the right kind of inputs. So we're going to learn about the right kind of inputs very soon. So it is self-correcting, self-maintaining, and self-healing body. And all nature has put everything together in such a way that nature wants us to live in a healthy and happy way, not to suffer or have diseases, heart attacks or strokes or anything. But because of the lifestyle that we chose, the modern lifestyle that we chose, that's how it has been happening to all of us. And then we keep accumulating toxins, and the buildup of toxins will create more issues. So this is a different kind of concept. All of you, this natural hygiene used to be very famous in United States once upon a time. Even in 1950s, 1960s, they used to have a lot of natural hygiene camps in the US. People would just go there, attend the camps, take courses, just like how you guys are doing right now, and understand what to eat, how to eat, and what is disease, and how to take care of ourselves without the need for all this blood work or checking labs and all kinds of things, or keep going to doctors, from one doctor to another doctor. So this is what Nature Cures Natural Hygiene is about. Have you guys heard about natural hygiene or any kind of natural hygiene centers here? It used to be until 1950, 1960s, even in 1990s too. Austin used to have TC Fry's healing camps and all of them, where they used to teach courses to people like you all who want to know more about health and who want to take care of their health without any kind of middleman in between. Anybody heard of natural hygiene? Because it's one of the oldest natural health sciences, and it's very intuitive, and that's the best thing anybody can read and try to understand what health and disease are all about. So it looks like it's new. So now that I told you about what Nature Cures is all about, so we're going to talk about cholesterol. According to cholesterol is actually a very important component of every action that happens in the body. Okay, so vitamin D. Pretty much all the hormones that we know have a base of cholesterol, like the sex hormones, like cortisol. All of them, they need cholesterol. And also each and every building block of the cell will need some amount of cholesterol. So you're thinking that we can strip off each and every cell of the cholesterol and keep lowering the cholesterol to as low as possible. It's not the right thing to do, because at cellular level, at hormonal level, and at vitamin level, because we need vitamin D and all the fat soluble vitamins, there is component of cholesterol in them. So at cellular level, every action is going to suffer. So imagine someone who was just told he has high cholesterol and he taking this high doses of statins and he keeps bringing down his cholesterol to such a low level. Then there is no real cholesterol, useful cholesterol that anybody can use it. So it's going to be very hard. So body makes as much cholesterol as needed. It does always supply demand. It's because body can make pretty much synthesize everything it wants to. All it needs is a basic raw material in the form of little bit of fatty acids, or amino acids, everything. So dietary sources of cholesterol that are coming from high fat meals in the form of fried foods or any kind of animal sources, these are the main reasons why there is external amount of cholesterol that's coming from our diet. But if the body is left alone without any kind of external supply, it will synthesize the needed amount of cholesterol. Then what happens to all these fatty meals or the toxic buildup that happens is cholesterol, the more toxic buildup happens, these toxins are pretty much acidic in nature, because we know lactic acid builds up and all kinds of acidic material builds up and kidneys are not working. So as the acids are building up, then the body knows that these acids are going to burn down all the organs. It's not good for it. So the liver starts producing cholesterol, which is nothing but the base, in order to neutralize. So an acid-base reaction happens. So these are nothing but the acid-base reaction things that are formed in the blood vessels as a plaque. And this is just the body's mechanism in order to save us from excess amount of acid buildup. So do you think it's a wise thing to chase a cholesterol, an innocent thing that came in order to help us out? Or the wisest thing, what is the wisest thing? Or to make sure that the acids are not building up in the system? Which one is better? To chase the innocent cholesterol or the acid buildup that is happening in our system? Once we answer this, then we no longer will be afraid of cholesterol, or we do not look at cholesterol as the villain. Cholesterol is actually our friend that is trying to help us out. Otherwise, each and every organ would have burned down. The acid-base reaction that takes place between the acids in the system and the cholesterol is the one that has really helped us a whole lot. So in order for us to do that, what we have to do is to have a better lifestyle and not build up too much acids and toxins in the system. So that's the most important logical, rational thing to do, rather than chasing an innocent bystander or a friend of ours that is trying to help us with stronger statin medications or cholesterol medications that have significant amount of side effects. So am I clear on this one? So you guys have to understand, because we cannot just keep on killing our friends or suppressing our friends, but we have to understand why our friends are acting up, and we just have to understand where it's all coming from. Now, the root cause of high blood pressure, according to allopathy, they say, oh, blood pressure goes up because of too much salt in the diet or because of aging or something or the other. According to Nature Cures natural hygiene that we use, it's unhealthy lifestyle. You all know what builds up a lot of toxins and acids in the system. And these toxins, what happens is they make the blood flow so sluggish, just like this river that's polluted, that is not clean enough. So it is moving very slowly and sluggishly. So imagine there is a lot of plastic and chemical and everything. The river doesn't even flow. It's so stagnant. So when the blood is so stagnant and it's not flowing very well, then the body, as a reaction to that, because what happens when there is no blood flow, the organs that are there downstream, like the kidneys, eye, heart, they all are suffering. They don't get the nutrients, they don't get oxygen. Then the body is going to say, okay, wait, the blood is very thick, it's sluggishly flowing, I have to do something. So it increases the tone of the blood vessels so that there is increased amount of blood flow to all parts of the body. It's actually our body trying to do something in order to compensate for the sluggishness of the blood flow. So on our part, now that we know it's our body trying to do that, should we aim at lowering the blood pressure to as low as possible so that the other organs are going to suffer? They won't get nutrients, they won't get oxygen. Or should we look at how unclean the river is in our system and try to clean it up? What is the wisest thing to do? Suppress this blood pressure or to clean it up? So we have to figure out what to do. So I think the best thing that we could do is not to suppress this blood pressure issue because organs are going to get damaged, but to clean up the river within us in order to make it much more clearer, much more free flowing rather than the sluggishness that we have in the system. So is this clear on toxemia? Toxemia is the main reason, an inability to eliminate waste that are built up in our system. Waste can be internal as well as external, and they are all built up because we are not giving enough time for the body to clean up. This is as simple as it can get. So there are 3 ways of elimination. Lungs, kidneys, and skin are the ones. For example, carbon dioxide is a waste. That's why you breathe it out. Imagine keeping that carbon dioxide in us for a couple of minutes. No, there is no life that can exist like that. We have to blow it out. Same thing, kidneys are working 24/7 in order to filter out that blood, in order to give you that clean, pristine river. See how clean the river over here is? That's how the fluids in our system also have to be. Otherwise, every organ is going to start suffering. They won't have enough oxygen. They won't have enough nutrients that are there. And so once they start suffering, then there is going to be so many reactions happening. So then what does allopathy do is they kind of like mask it off. We don't ever address this toxic buildup in our body. All we do is we kind of like try to give a pill and like try to mask the numbers, try to make them look decent enough. But underlying whatever that, remember that unclean river is still flowing everywhere. Every cell is receiving that unclean river. That's not like compatible with life. At some point, the body is going to say, this river is way too unclean. I cannot survive like this. I have to clean up. So your body is always self-healing and self-correcting and cleaning up. So body heals automatically with the right living conditions and right inputs. So medicines, all they do is they block it up a bit so that you are just going to be happy with the numbers that are there, but you never know what is happening inside you. That unclean river keeps getting clogged up, more and more waste gets dumped in, and it really suffers a whole lot. That's when all these end organ damages and everything happen. So no matter how many medications we give ourselves in order to make it make the blood pressure lower, cholesterol as low as they want, they never were able to get the right things out of it because the underlying toxic buildup kept going on. Next slide. So now that you guys understood what toxemia is all about because of the waste elimination, can you answer this question for us? When a person says they have diabetes, high blood pressure, thyroid, high cholesterol, coronary artery disease, etc., what does that mean? It means toxemia from modern lifestyle. They have a huge issue with one particular organ. Rest of the body is just fine. Just take the pill for the disease. It is just hereditary or age-related, and they cannot do much. Just accept the pill, accept the diagnosis, take the pill. Next one is they should forever take those pills. Now that you understood what we are trying to tell you about how lifestyle aberrancies or erratic lifestyle builds up toxin buildup. Now tell us what you think. Are you going to like look at it as a continuous process of just taking pills throughout the body, or is it just one organ that's affected? Well, the whole entire bloodstream, the interstitial, the fluids are affected. They're so sluggish. Do you think one particular organ is the only thing that's affected, or is it just age-related process? So what makes you think, what is the cause of high cholesterol or any of these lifestyle conditions now? So it's all from toxemia. Remember that river in our, like whatever, anything you want to take out of this lecture today or this session today, just remember that unclean river and the clean, pristine river. Our fluids in the body have to be that clean in order for us to perform well and to live better. So yes, you guys are answering well. Toxemia from modern lifestyle. So please remember this word toxemia. Lot of, allopathy doesn't use this term, but this is a beautiful way of explaining how disease is caused and how health is created. The more the toxins we have, the more disease is built up. The less the toxic system we have, the more health we have. That's as simple as it gets. So now let's quickly go over stage A, stage B, and stage C as blood pressure progresses. So initially we are diagnosed with blood pressure. The doctor is going to say, oh, you have high blood pressure. And he gives you a prescription with one pill. Then again, after 6 months or 8 months, you go back. And then he says, low salt diet, but your blood pressure is still going up. And then he writes you 2 different medications, 2 different pills. And then he's also going to say, oh, your thyroid, you do have some sort of a subclinical hypothyroidism, a thyroid medication, diabetes medication comes into play. Well, time progresses, 2 more years go by. Then we go into stage C. Any idea what stage C is? Stage C is complications because of heart disease or kidney issues or eye issues because of long-standing history. Remember I said at the surface level, with these pills, we can make everything look better. But remember the brewing, the sluggish, unclean river that's flowing everywhere. Well, when the river in us is not clean enough, that's what happens. End organ damage happens. Next stage would be a stage D, multiple medications, multiple different diagnoses in the form of lifestyle conditions, multiple hospitalizations. We end up with kidney transplants, end-stage renal disease with a dialysis, or some eye issues with laser treatments, and finally a heart attack or something or the other. This progression of disease is going to be happening all the time. This is what we say, right? Day in and day out, a 50-year-old man gets diagnosed with high blood pressure. After 10 years or 15 years, he's going to end up with some sort of a heart complication or some brain stroke or some other issue or the other will happen. This progression is going to keep continuing. No matter how many medications we take, we cannot stop this progression from happening. So now what is that we can do now? Now that we understand what toxemia is all about and how progression of disease happens and how pills are just masking the system, let's see what happens. Have you guys heard about Dean Ornish by any chance? He comes in a lot of health shows and all that. So he's still the President Clinton's health advisor. And President Clinton, when he had his bypass surgery done, he went on a whole food plant-based diet. So he's one of those big proponents of whole food health. Plant-based diet systems and how to clean up and all that. So one of the important implications of this new unifying theory of lifestyle medicine is to stop seeing chronic diseases as being fundamentally different from each other and to begin viewing them as diverse manifestations and expressions of the same underlying biological mechanism. So what he's talking about is toxemia is only one, but it manifests into different kinds of diseases. Some of you may end up with high blood pressure, some of you, depending upon wherever the weakness is, some of us will end up with diabetes, some with thyroid conditions, some with everything falls under toxemia, but how we view it as different. So in allopathy, what happens is we just look at these branches, but we never try to look at the trunk and the root of these causes. That's when the issues will start. So this is what he's been talking about. And even now they're all catching up with natural hygiene. This is one of the most, natural hygiene has made it so crystal clear. Even a non-physician will understand what this is all about, what health is all about right now. Next slide. Now, Dr. Caldwell as Associate, he is in Cleveland Clinic. He's a CT surgeon. He's a bypass surgeon, and he was operating on a lot of hearts. And then he just felt disgusted at looking at, ripping open patients' hearts and taking putting all these grafts and everything. And then he said one day, why is this happening? I'm just going to look into this one. And then he started looking at their diets, and then he started correlating everything. And he kind of put it together that excess amount of animal products, excess amount of fats, unnatural lifestyle is the main reason, as a root cause of this kind of significant heart conditions that we are seeing. So the same nutrition which eliminates heart attacks and strokes also eliminates obesity, diabetes, high blood pressure, and the common Western cancers, gallstones, diverticulitis, osteoporosis, dementia, everything. Remember, you can look at it as one branch in allopathy, but all of them have the same root of toxemia, and then the toxemia has the same basis of abnormal, erratic lifestyle that we are living in. So it will not come from a new pill or a procedure. It will come when we in medicine and science share with the public the knowledge of a lifestyle which will diminish and eliminate our common chronic killing diseases. That's what it's all about. Yeah. So that's what it's all about. So, and now we have John McDougall, who is also another plant-based doctor. Do you guys guys heard about their names? They do have books and everything written. So high blood pressure does not cause damage to the arteries. Healthy blood vessels don't break. Blood pressure is necessary to supply nutrition to all body tissues, especially heart and brain. So just like, remember all those patients when the blood pressure was very low, much lowered, with medications, they were passing out, they were having kidney issues and everything. So over treatment decreases perfusion pressure to heart and brain. And when they don't have proper nutrient supply, when they're not functioning properly, that's when other diseases also will set in. So high blood pressure is rather a sign of a sick circulatory system, sick heart, blood vessels, and blood. So again, putting a mask or a band-aid on whatever that is brewing underneath is not the right answer, because the organ damage will keep happening. So what do we do now that we realize what is happening? So what are we going to plan on doing? So are pills the only solution to what kind of things we are doing? Drugs cannot effectively treat this disease, which is merely a side effect of an unhealthy lifestyle. So remember, stepping on the gas and the brakes at the same time. So whatever that is brewing, and then on top of it, we add some more fuel to the fire in the form of toxic medications. So no medication can do what a dietary and lifestyle overall can. So now that you have the understanding of what happened, how we have built up high blood pressure, cholesterol, and why we are progressing more and more towards heart disease and the strokes and all of them. Now let's launch into figuring out how do we stop this from happening, and how do we take care of it by addressing our lifestyle. This is done. So again, stage A, stage B, stage C, and stage D diseases, we don't want to get even into stage A. At any stage, we can reverse this just by addressing our lifestyle, and we can minimize the number of medications that you're going to be taking just by addressing our lifestyle at this point. So doctors always tell us with the prescription that they have, I told you, we basically have 10, 20 minutes to spend with you. So we just talk about numbers and everything. None of us have enough time to talk about toxemia or how things build up. So what they do is check blood pressure. They tell us to eat healthy foods. Then they limit the salt intake. Then high blood pressure medication, few medications are passed on. And then they say, don't smoke, but the thing is, we don't know what to eat. When we do not add any salt to our diet, then it tastes so horrible. Maybe for 5 days we eat it, and then we go back to our old ways. How do we maintain consistency? How do we build up a lifestyle and habits? That's the focus of our program at this point. So start your reversal journey. So what we have with the 3 points. So this is we are going to do it. This is more like a coaching, okay, month-long coaching. But today we're going to offer you a few tips in order to understand what this program is all about. Then you can have more confidence, and in order to have trust and faith in the system that we are using. So fruits, 3 action point steps that we are going to do are fruits for the win, keeping ourselves active, and intermittent fasting. I'm sure you guys heard a lot about intermittent fasting. That's very much in vogue right now. Have you guys heard about intermittent fasting? We're going to explain to you more on why it is very essential for us to use intermittent fasting. So fruits for the win. Why are we saying fruits for the win? So it's purely fiber, plenty of nutrition, and there is pure natural water in it. It is the original fast food. Bananas are considered as the original fast food. If you see any of the ads for bananas, you're going to in the store, they're going to say the best fast food given to us by nature, it's bananas that comes to that's the one that they label us. So there is no salt that needs to be added. There is no condiments. There is zero amount of fat that now we're going to add to it. No oats. So then just don't add any of them. Just add, just eat fruit as is. So at least 3 servings of fruit. So how do we know we are eating 3 servings of fruits? We can eat fruit for breakfast. Remember the kind of breakfast that we are all used to. What's for breakfast today for any of you? You guys can put it in the chat. I just want to understand what you usually eat for breakfast. So is it oatmeal? Is it bacon with eggs? Or is it toast? Is it Fruit Loops with cereal? Or is it just fruit with some cereal? What is breakfast today for you guys? So eggs and ham, Jessica. Cafe. ABC juice with chia seeds. So ABC juice is apple, beetroot, and carrot juice. So there are different ways of ensuring we get plenty of fruit. So let's check it out and see how much fruit we can eat and how well we can do. Fry cake beans. So yeah, next slide. So eating fruit, how do we ensure we get 3 servings of fruit? So let's shift our breakfast from cereals, eggs and meat and other processed and cooked food to a hydrating meal of fruits. So here we're going to explain to you a little bit about this cycle. Have you ever seen this cycle before? So what happens is our body is not a multitasker. It cannot digest and it cannot repair, it cannot clean up at the same time. So this is done at a different way. So as the sun comes up, that's when all our digestive juices and everything are at optimum level. And as the sun sets, that's when all the digestive juices go down. So that's the optimum time of eating. So we shouldn't be it's better to avoid eating early in the morning. Remember that 7 a.m. coffee, tea, and 8 a.m. Some amount of Fruit Loops and cereal and all of them. Our body is not in the state to digest any of it. So it's better to avoid any kind of complex foods around that time. So by sunset, that's when the body is in the process of, settling, cleaning up and sleeping. So that's when it's better to not eat after sunset. It's decent enough. We just have to eat in a very narrow window. Then as we sleep, that's when all the repair happens, all the wear and tear, the blood vessels, everything, all the rebuilding happens. So, and then once we were around 4 a.m., early hours, remember all the cleanup has happened, right? So once the cleanup is done, what happens is, and the material needs to be cleaned up. So all this is elimination. So imagine we are stopping that elimination at 7 o'clock with a big coffee or a lot of tea or some Fruit Loops and cereal. So this digestive phase moves up here and the elimination cycle is very, very small. The amount of time we contribute for cleanup is going to be smaller. So imagine over the course of years and decades, what happens? We stop elimination abruptly early in the morning by eating complex foods, and then the waste keeps piling up. And what happens when the waste keeps piling up? Toxemia builds up. So remember this one, because this is very important for us to understand intermittent fasting too. So first important thing is ensure three servings of fruit. Important thing. So no complex foods for breakfast. Switch the breakfast in order to, for example, if you're used to eating oats or any of these granola, consider switching to a whole fruit meal, Fruit Loops, oats, and then any kind of toast, sandwich, any of them. Reconsider it and increase this ensures that you take more fruit. It ensures that you're not stopping the elimination, because fruits are so simple and easy to digest. Your body will be in the process of cleaning up decently well. And also there is no salt. There is no extra salt. There is no extra sugar. Any of these ingredients that are high fat, high sugar, artificial, we're going to eliminate all of them and we're going to take natural foods. So that's where this fruit breakfast comes from. So that if you eat a big bowl of fruit, that will be enough. And then every snack, you can make it as a fruit. Fruit can be breakfast, fruit can be lunch, fruit can be dinner. So you guys can opt out and see. But pretty much all the snacks, whenever you have a habit of taking snacks, it's better to switch them to fruit rather than, any kind of chips and a dip and all that. So, and then stay active. That's most important thing, because when we are active, what happens is we sweat decently. So there is enough amount of blood supply and the toxins are removed through the skin. And also it moves the lymph. Lymphatics are nothing but the waste channels in the body that kind of like drain all the waste towards the kidney or into the circulation, and then they're filtered out. So it's very, very important that we move our limbs. So the lymphatics do not have muscular system or any kind of muscles to pull it. It's our exercise that's going to keep moving the lymphatics up and down. Body is built for movement, so stay active as much as you can. Decent amount of sweating is needed for all of us in order to ensure that the toxins are coming out. Consistency is more important. Every day, make sure you go for a 30 to 45 minute brisk amount of walking and decent amount of stretching. It doesn't have to be like in a gym or any of them. Anywhere you can get a brisk amount of walking that will enough to make you sweat, as well as decent amount of stretching will keep that lymph moving and will help you to remove toxins from the system. And now intermittent fasting is the one that I just showed you. Remember, there is plenty. So we are not meant to be eating round the clock or every 2 hours. We have a very narrow window of eating when the sun is up, really up until sunset. So if you can follow like a eating period of like, if for example 18 hours, 8 hours, and then leave the rest of that the time, like whatever that is left, for example 16 hours of not eating. Some people do 12 hours, some do 14, some do 16 hours of not eating. But if you can do it that way, to keep that window of eating narrow and not eating round the clock, this will really help to eliminate toxins, also improve your metabolism, and all of the insulin resistance improves, obesity numbers, weight loss will happen, decent amount of weight loss, high cholesterol numbers are going to improve, hypertension numbers are going to improve, all kinds, if you're suffering from any joint inflammation, joint issues, all of them will also improve at the same time. So it's very important. Intermittent fasting, I'm pretty sure you guys heard about it, but you didn't understand the scientific reason behind this one. But the scientific reason behind this is body is not a multitasker. It can digest only in a particular amount of window as the sun comes up, and then body has different sets of the tasks that are assigned. So during elimination phase, it's better not to interrupt the body with complex foods or any kind of complex eating, high salt foods, and all of them. So that's where intermittent fasting helps in order to eliminate toxins. So sugar numbers improve. So somebody who has pre-diabetes, if they can do a strict amount of intermittent fasting, it helps a whole lot. Anyone with cholesterol issues, if they can strictly follow that particular window of eating and not eat every 2 hours or eat round the clock, or not early morning eating or not late evening eating, it will help them a whole lot to improve their numbers. Next slide. I think time restricted eating is easier than calorie restriction, because calorie restriction, most of the time, like 1200, 1800 diet, sometimes how long can we just keep counting our calories and eat, even though we feel like we are hungry and we have an appetite to eat? So hunger is a product of work, not the amount of time. So work your body up and then sweat a bit and follow this strict window of eating. You're going to see immense changes in weight loss, as well as improvement in numbers. 12 hours, 16 hours, 14 hours, the gap between dinner and breakfast goes stepwise. So if you're used to eating round the clock, do a 12-hour window of not eating, then gradually increases to 14, then make it to 16 hours. I think 16 hours is the best thing a lot of people are able to achieve right now. And they're also seeing a lot of health benefits too when they're not eating around the clock. So we have 3 points, 3-step program for you, and these are easy to implement, and we have explained to you scientifically with plenty of logic to understand what this is all about. Fruits are the best sources. We do not add any kind of salt or anything. So there comes your low salt diet. You don't have to worry about what to cook. And also intermittent fasting is essential because, remember, body doesn't multitask. There is a period of eating, there is a period of repair, then there is a period of cleaning up. So this is very important. No tea or coffee during intermittent fasting. It's just plain water. That's all we need to do. So if you can do these three things together, following fruit as well as intermittent fasting and decent amount of exercise workout, not the kind of like, gymming and excessive amounts of calorie burnout, a brisk walk in order to make you sweat, as well as basic stretching, numbers are going to improve a whole lot. And so you won't be needing extra amount of blood pressure medications. Maybe that pre-diabetes state is going to resolve, or the pre-hypertension stage is going to resolve. So borderline, everything will improve. Only thing is we need you to start doing this lifestyle coaching for yourself and start implementing it. So there are multiple healing stories that we have from our side that we want to share with you. These are previous participants, just like you all, who came to us, and they because lifestyle doesn't happen, like the way we learn doesn't happen overnight. It's not a crash course. So we teach you, we guide you. It's more hand holding. So slowly people will start implementing throughout their lifetime.
Thank you, Dr. Prashanthi, for taking us through the whole, chain of how blood pressure and cholesterol develop, and how actually the body is self-healing and adapting to these different conditions of toxemia, and the three-step action plan on how to easily help prevent and reverse these health problems. It was very eye-opening. So I hope that wherever you are, you can already start implementing these three action points, because they are so easy to do, right? So no complex medicines, no complex treatments. The body works with what we give it as inputs in the form of food, fresh air, sunlight, rest and relaxation. So how did the people who joined this program in the previous batches achieve it? We have a lot of good news for you, a lot of promising, positive news about people who reverse these health conditions naturally. So here are some case studies. Here was a 70-year-old man who had undergone bypass surgery, and he was still on and off episodes of chest pain, but his BP was not well controlled. His doctor increased his medications and told him to consider a low salt diet. He incorporated a natural diet and lifestyle modification. Gradually, he was able to see changes. He was able to walk more blocks. His BP stabilized and his medications were tapered off. He lost 20 pounds in the first 6 months. Case 2 was a young 38-year-old who checked his BP at a recent health fair conducted at his workplace, and it was high. It was in the range of 180 to 90, and he was really worried and kept checking it. His BP was still in the range of 180, 160 over 70 to 80. And he enrolled in the lifestyle correction program with Dr. Prashanthi Atluri. He was able to quit all his processed foods, increased fresh foods, a little bit of fasting, as we explained, and he was able to see drastic improvements. His weight dropped by 10 to 15 pounds in 6 months, and he has since continued on this journey. So here is Ravi Chandra from Bellevue in USA. He came to us when he was in a huge dilemma because his doctors were recommending him to start statins to reduce cholesterol, which he was going through for past 1.5 years. And they were really asking him to start the medications because they told him it was dangerous, and high cholesterol had lifelong side effects. So he came to our program when we started the first batch, and he was a very enthusiastic participant. He underwent a lot of unlearning and relearning, as he says in his own words. He diligently followed the guidance and help, and he came to know the magic of sun, fruits, vegetables, intermittent fasting. He was able to lose a lot of weight, around 15 kgs, and in 67 weeks he felt more alert, lighter, happier. He was also at the end of the program inspiring so many other participants to take charge of their health. So he says that with a lot of patience and persistence, you also can achieve the same. So here is Rakesh Kukreja, who was a recent participant of our workshop. So he wrote to us with a lot of happiness because he was in a state when he came to us with a lot of medications. He was taking medications for blood pressure, cholesterol, blood thinner, psoriatic arthritis, uric acid, and anxiety. As you understood from the program, Dr. Prashanthi explained that one problem leads to the other. The one pill leads to more pills, poly pills, and more complications. So that was the state of Rakesh, who came to us, and through our program and following diligently all the guidelines, within 30 days, he could stop all these medicines. In fact, some of these medicines he had started when he was a teenager. So he realized that all these medications was not required at all because the body is self-healing. He also lost 7 to 8 kgs, and he has been continuing with us, taking the coaching and keeping himself inspired and also inspiring others. So this is the magic of Nature Cure. And this is Sarita. She took coaching for us for 2 months, and she says that she achieved freedom from blood pressure, sugar, cholesterol, thyroid, and even vertigo. She was taking medicines for all these things, and she says in 2 months, all this journey with medicine ended, and the journey to better health started. I got back high levels of energy, reduced pain, lost 6 kgs, and rejuvenated with the help and guidance of Dr. Prashanthi and Asha, who's myself. So she says, and she was also a very inspiring participant, always sharing her food pics, talking about what she ate, the time she's enjoying in nature, her relaxed lifestyle. And she also asks others to enjoy this natural lifestyle, stay committed to staying and eating healthy foods. So if they can do it, surely you can also do it, because as Dr. Prashanti also explained, this self-healing capability of our body is there with all of us, actually not just with humans. It is a property of all living matter. So this is what we need to harness on our total journey to good health.